Firefighters don't tend to spritz a wildfire with water every so often and call it a day. Usually, it takes a little more focused, sustained effort. So, how come when we go to treat surface wounds and infections, we often settle for something that doesn't stick around to finish the job? Chronic rhinosinusitis, or CRS, affects up to 10% of the population. If you've got CRS, you've spent 3 or more months with pain or pressure in your face, a very blocked or runny nose, and less taste and smell than you used to have. Sometimes the reason CRS sticks around is due to bacterial infections that form protective huddles like penguins do, which makes it harder to treat. So the best way to treat something like this would be with a topical agent that directly fights the bacteria, not a pill you swallow that affects your whole body. The main issue with this is whatever you put up your nose is very good at kicking out again. So here's where I come in. I am developing a new little agent that you can spray into your nose that will break up those penguins and expose them to the frigid cold. However, I'm also going to make it stay there by making a hydrogel. This gel is liquid at room temperature, but once it reaches the temperature of the nose, which is about 34 degrees, it turns into a gel. And because it's no longer a liquid that can be easily washed away by your nose, it will keep working while it sits there. Don't worry, you will not permanently have gel in your nose. Remember, it becomes liquid again at room temperature. So after half an hour, you can simply rinse your nose, as many CRS patients do, and that water will turn the gel back into a liquid and it can be safely washed out of you. How do I know this will work? We have a Perspex 3D printed CT scan of a CRS patient's sinuses. That means I can heat this guy up to 34 degrees, spray in some colored gel, check it gels, and check it washes out. I'm using povidone iodine, which you may know as betadine. It's a common skin disinfectant that has been used for decades and is both safe and something bacteria have never evolved resistance to. So why the hell do you care if you don't currently have CRS? Remember those penguin huddles from before? Well, we're going to call them what they actually are, which is biofilms. Biofilms are responsible for a lot of chronic infections worldwide and are associated with 60 to 80% of all microbial infections. No matter your academic focus, we all know antibiotic resistance is on the rise. If we can target the strategy bacteria use to escape eradication, we'll be getting closer to dousing the wildfire, not misting it.